Good afternoon, everybody. We're going to wait just a few seconds while we get everybody hopped in here to the meeting, and then we will begin shortly. We're so glad all of you can be here. Let's see. All right, we're going to go ahead and get started. Good afternoon. My name is Jenny Clore. I'm the Vice President of Operations with the Church Benefits Board. I am joined today by my wonderful team at CBB, as well as Owen Smith with Hilb Group. We're going to be going through some much anticipated questions regarding health insurance. This is the topic of conversation these days, especially as we are walking into open enrollment for many of you. So we're excited to welcome Owen Smith with Hilb Group to kind of answer some of these questions that you all may have. Just a few housekeeping items as we get started. Please make sure you remain on mute during the presentation. If you have any questions that come up during the presentation, make sure to put them in the chat. Don't want you to lose those questions. We have someone who will be monitoring the chat for us, and we will address the questions during the Q&A session, as well as throughout the presentation. So without further ado, I'm going to hand it over to Owen Smith. Thank you so much for being with us, Owen.
Great. Thanks, Jenny. It's great to be here with everyone today. It's 12:02 here on the East Coast. I think most of us are on the Eastern time zone. So yeah, fresh into the afternoon on a Thursday. And who is more excited to talk about insurance than I am? So we are going to review through a few concepts. The slideshow is not particularly long. We really have 3 slides because when we think about health insurance, there are really 3 different avenues that folks in the country can access health insurance. So we're going to cover concepts related to group health insurance. So this would be an employer type health plan, which is, of course, very prevalent in the US. Then we're going to talk about individual health insurance. We can get into discussions of on exchange, off exchange. So again, you're really interfacing directly on your own with a carrier and purchasing you and or your family's insurance on an individual basis. And then the third thing we're going to talk about is kind of a mixture of both. This is probably the newest, latest and greatest iteration of a very slow to change industry when we think about health insurance. And this would be an ICHRA. That is an acronym because we love acronyms in the insurance industry. So we're going to talk about an ICHRA. I'll give a little sneak peek. That stands for Individual Coverage Health Reimbursement Arrangement, so ICHRA. Well, let's go ahead and toggle to the first slide. Oh, forgot about that one. I have to, I guess, more formally introduce myself with my outdated picture that was heavily airbrushed. I'm sure everyone can sympathize with that, the need to do that these days. So I'm based here in Richmond, Virginia. I've been in the employee benefits arena for going on about 25 years now. I specialize in group employer health plans, dental, vision, disability, life insurance, long-term care, really anything that you can put into place in an employer plan. And then certainly dabble quite a bit in individual plans. We'll talk more about this when we're on the individual health slide, but I do have someone else in my office that really takes the lead on placing individual coverage, but I certainly know enough about that to be able to chat through some conversational topics today. So that's just a little bit about myself, and I'm sure I've emailed and maybe spoken with a few of you on the call today. So let's go ahead and review some basic concepts with employer coverage. I think this is probably, certainly the most prevalent. I've worked with a lot of churches over the last several years, having formed the relationship with Church Benefits Board. And, this can be a big struggle for a lot of churches because we just don't have the numbers all the time to be able to form a full-fledged group employee benefits plan. Certainly there's a lot of church organizations out there with 1, 2, 3 eligible employees. So I'm just going to kind of go through these bullet points And again, just this is really designed to just sort of get you to think about things. Again, feel free to put your questions into the chat, and we'll certainly uncover those at the end of the meeting. But when we talk about group health plans, you do have to have at least two eligible full-time employees. Full-time is generally perceived to be 30 or more hours per week. And you have to have, a group of employees to be able to form a group contract. So if you are at a church with just one employee, maybe one single pastor employee, we know right off the bat that a group plan is just simply not going to be feasible for you. Um, so you do have to have two eligible employees. Some carriers, you'll see in the parentheses, some carriers do allow, as long as you have two eligibles, they will allow you to install a group plan if only one of those employees participates. So I think that's a big distinction there, is that, you have to have two eligible, but if one person is on their spouse's plan, or maybe they're on an individual plan, that's okay. You might still be able to squeeze by with just one person enrolling. When we talk about group health plans uh, in your size market, which is small group is classified as 2 to 50. I don't know that there's many churches out there with more than 50 employees, but 2 to 50 is the small group market. And that's going to mean that those plans are going to be age rated. So literally the rates are based on every single person's age that's enrolling. So the employee at age 50 might have one rate, and then the spouse at age 45 will have a lower rate. All the kids at a lower age will have lower rates. Certainly, if you have a 60-year-old on the plan, they're going to be at the top end of the scale. So again, every single year of age has its own assigned rate. And so certainly as people age up through the years, we know that those rates unfortunately continue to increase. And this is the same rating philosophy that you'll find in the individual market as well, which we'll talk about more in a second. These group plans are, 1-year policies. So you enroll, you're going to have, or I should say you install a group health plan, you're going to have a renewal in 12 months. So these are 12-month contracts. So every year, I wish I didn't have to say this, but every year the rates are going to increase. I mean, we are seeing that in the small group market, not only do the rates go up because everyone ages each year, but it's just unfortunately a very volatile, just like maybe some of you are familiar with the individual market, especially at this inflection point of the country. It's just a very volatile market. And some of these, or most of these small group employer plans are still seeing, unfortunately, just sizable rate increases. There's really no, the rates are canned rates. So they are based on geographical area and age. So the rates just do what they do each year. There's really no control that we have over how the plan operates, because the rates are just sort of standardized set rates. In order to get a quote, we do need census information. So, name, date of birth, zip code. That's pretty straightforward. Most carriers, have a range of plans from, bronze level, silver, gold. If you can still afford platinum, those are the top level, super rich plans. I find that most employers are simply, and employees really, are simply unable to, spend the dollars to obtain platinum level plans. Certainly when the Affordable Care Act was first rolled out, plenty of employer groups were, gold and platinum. I see most employer groups, unfortunately these days, bronze, silver, maybe a gold is their richest level plan, but the platinums have just kind of priced themselves out of existence. And of course, the premium would be paid to the carrier by the church. So because it's a group contract, this is really between the church policy owner and the carrier. So the employees are just, payroll deducted, whatever the church is offering, that's the plan. But the contract is between the church and the carrier. I would suspect that a lot of people have some experience with group health plans. This is certainly the sort of the norm in as how employees across the country get health insurance. But I'll pause here and see if we have anything in the chat as it relates to group plans. We are going to talk about individual coverage next. So I'll pause just a second. Do we have any questions we need to address? Nope.
I
I'm going to take
don't
that as a
see
no.
any.
Okay.
Yep, I don't see any in the chat. So I
All
think
right.
we're good for now.
Perfect. Let's transition then into group coverage, if this will work. There it goes. I'm sorry, we're going to transition into individual coverage. So this one's an interesting time. We picked this date quite some time ago, not realizing that our government would literally be at a inflection point, really surrounding the individual market. So I could get on my soapbox and talk about individual plans and the marketplace and subsidies and everything, but I'll save that for another day. Let's just run through sort of how the individual market works, um, and talk about the state exchange. I know in Virginia, if you're in Virginia, we have our own state exchange. Some states still have not adopted their own state exchange, so you might still be using the federal exchange, which is marketplace.gov. So it really depends on, a couple of different factors of what exchange you're engaging with. I will also remind everyone, because this kind of gets folks confused a little bit, the individual market is not only on exchange. There's such a thing called off exchange as well. And the individual market, which has existed for decades, allowed people to go directly to a carrier. Here in Virginia, I'm just gonna pick on our Blue Cross Blue Shield carrier, which is Anthem. I know in North Carolina, you're Blue Cross Blue Shield North Carolina. But I'm going to pick on Anthem Blue Cross Blue Shield. They sell individual plans directly to people. You can go to Anthem's website. You can buy a health plan directly from Anthem. That would be considered off exchange. You're not interfacing with the state or federal exchange to buy your health insurance. So again, the concept of going directly to an insurance carrier, which was how people did it before the Affordable Care Act was rolled out under the Obama administration. So we're a good 15 years into this, but if we think back to pre-ACA, people just went to an insurance carrier and they bought their coverage. So in this day and age, that would be called off exchange. The reason the exchange exists is to allow people to go to I'm just going to pick on, again, the federal exchange, marketplace.gov. And the only reason people do that is to see if they qualify for the tax credits. Okay, so if your household income is of such a level that you qualify for any sort of tax credit, tax subsidy, then you have to go through the exchange, because that is how you're linked in with the IRS and all the moving parts to qualify you for that tax subsidy. That's the whole purpose of going to the exchange. And it also has created a shopping experience where you can see all the carriers, all the different plan levels, interface with the tax subsidy calculation module, and that's how you can buy your plan and see what your final price is going to be. So we call that on exchange. So certainly, lots of people have qualified for those tax credits over the years. I will touch briefly on the behind the scenes look of the current government issue, because during COVID, that is when they bumped up a lot of the tax credits and tax subsidies to sort of help people maintain or purchase health insurance. So during COVID, we saw a wide range of people that previously were not financially eligible for those tax credits pre-COVID. They made too much money. But during COVID, when the tax credits were enhanced, that is when suddenly we saw a lot more people qualifying for tax credits and subsidies. The numbers of enrollees on ACA plans jumped significantly. So this is the piece that the government's wanting to pull back on, those enhanced subsidies. So certainly folks are currently getting letters in the mail right here, at this point in time, talking about the pullback of those tax credits and subsidies. And not only that, but the carriers are also sending out their renewal letters. So if you're in that situation, it's kind of a difficult time right now. But that is kind of where we're at with the exchange. Um, if you're new to searching for individual coverage, so I kind of spent a little bit of time just kind of explaining the dynamic, and I spoke briefly to people that might be on an exchange plan now and are getting those letters in the mail. But if you're someone that is needing to jump into that world of getting individual coverage, I'll chat briefly on that. So again, if you can't form a group, then really an individual plan is the next alternative. I will tell you the second bullet point. It's best to work with someone to let them navigate you through the exchange. The price is the price. The rates are the rates. So it's in my opinion, it behooves you to let someone else guide you through that, especially when you're adjudicating the dollar amounts of your income. I'm sure someone at CBB could, jump in and kind of chat through, we've got the housing allowance situation that can factor into your household income. So that's something to be cognizant of. But you're going to pay the same price whether you do this all on your own and just kind of hopefully figure it out with fingers crossed, or if you use someone like my coworker Jackie House that helps people navigate through the exchange every day. That's all she does is focuses on the individual market, on exchange plans, helps people figure out their final price based on their household income. So I would recommend to take that approach if that uh, fits your need. The plans do vary by carrier. Obviously, it depends on your geographical area. So if you're in Virginia, you're probably going to have, some Centera, some Blue Cross Blue Shield, United Healthcare. If you're in North Carolina, you're going to have Blue Cross Blue Shield North Carolina, probably United Healthcare, and the list goes on. So it depends on where you're at in the country as to what carriers show up for you. And then again, probably the last bullet point, you probably already knew this, but the premium is paid directly by you, the individual, directly to the carrier. Okay, so just want to kind of make that distinction between group plans. So I'll pause here again to see if anyone has any specific questions that we can chat through about the individual market. And the next
I
topic is
have,
going to be the ICRA.
yep, I have a curious question.
Sure.
The difference between off exchange and on exchange, if someone were like, are the age-based premiums the same regardless of like the difference is the subsidies? So if someone got a quote from an off exchange Anthem policy and then went to the marketplace and got a quote for the same policy but no subsidies, would the premiums be the same?
No.
No. Okay.
So again, I'm just going to pick on Anthem Blue Cross Blue Shield for our Virginia folks. Their off exchange plan offerings are not identical in price or plan design
Mm,
to
okay.
Anthem's on exchange plan offerings. So they literally, let's say they have 10 plans, platinum, bronze, silver, gold. Those 10 plans are going to be a particular plan design range and a particular price. Those 10 plans literally do not exist on exchange. They're going to be 10 equitable plans. They're going to be very close in nature, but they are not identical plans.
Great. That's
And
helpful.
obviously they're not identical rates either.
Yep. Yep. That's helpful. Nicole,
Owen,
we have a question in the chat.
yeah, well, we have a couple questions in the chat. The first one is from Jennifer Williamson and Ken Williams. How does a minister's housing allowance impact insurance consideration?
Do you want me to take this one,
I'm
Owen?
going to let Jenny take that one.
Sure. So, as you all know, ministers typically claim a housing allowance. When you are entering your income on the government exchange, you should only be entering your taxable income, which would not include that housing allowance. So, it is very likely, and usually the case, that ministers are eligible for increased subsidies because they are only reporting their taxable income and not including that housing allowance amount. So
Jenny,
And
there's that.
and I'll just let me add on to that. So if you work with a broker or Jackie, and one of the first things that she does when she engages a new prospect, if you will, is to send a form, and it says, provide me your household income. So it's really on, frankly, you to remember what Jenny just said, that, okay, I need to know not to include my taxable income.
Or
Jackie works
not
with a
include the
wide,
housing. Right. Not
sorry,
include the
housing
housing.
income.
Yep.
Jackie works with a wide range of people, so it's really, you guys want to just remember for yourselves not to include that household income, because she's not necessarily gonna pick up on that and guide you down that path. So I just wanted to be sure everyone on the call knew that.
Yep. And before we move on to the next question, if for anyone to utilize Jackie's expertise through the marketplace, is there an expense to the church or the individual to have her guide them, Owen?
No, that just goes back to my second bullet point. You don't pay any more or any less. There is a commission that is paid directly from the carrier to Jackie or our insurance agency, but that does not impact your final rate. So if you figure it out on your own, you're going to pay, let's just pick a number, $500 a month. If you work with Jackie, you're going to pay $500 a month. There's no
Great.
difference between doing it on your own or having someone help you.
Yeah, great. Excellent.
Great. So we do have a two-part question. In addition to housing allowance, isn't there a self-employed health insurance deduction that would impact reported income for the marketplace? And how do those work together?
That sounds like a more of a higher level accounting question than I'm prepared to answer. Jackie may have some insight into that. But yeah, when we get into small business ownership arrangements, I am not able to answer that specific question. But I would probably, again, if you engage with Jackie, she may be able to answer that. But that also just might be more of a higher level accounting question as well.
Yep. Michael, we'll take that away.
We get
Yeah.
that a lot in the insurance industry. We always say, like, we're not necessarily in accounting, so we sort of try to stay away from those detailed level questions.
Yep.
Great.
We'll take that away. And if we can't find an answer, Michael, we can direct you to an accountant who can assist. So,
And that is all the questions in the chat right now.
Okay, let's keep moving then to the third topic, which is, oops, the ICRA. Was I already on that? So this again is a little bit of a newer concept. I really just have sort of chatted about this with folks maybe over the last 6 months or so, just as a background on what this is. When the Affordable Care Act was rolled out under the Obama administration, one of the provisions of the ACA was to disallow employers to pay for individual plans. So I should say on a sort of pre-tax basis. And so I know that there's a lot of churches out there, I've chatted with you all, that take the approach of, providing a stipend of money. That's fine. What I'm saying is to be able to mimic what employer plans do, which is to help pay for an employee's health insurance and then to have a payroll deduction that is pre-taxable. Under the Affordable Care Act, that concept was not allowed. Then we had the first Trump administration come in and say, no, we do want to allow employers to help provide payment for individual health plans. And so that law was passed under the first Trump administration. But skip forward, a number of years. We went through the Biden administration. Now we're back to the second Trump administration. That law that was passed under the first Trump administration is really just now starting to materialize in a easy to understand format for small group employers to be able to pallet. Just because the federal government says you can do something, putting that into action and actually doing it in all the compliant methods can be difficult. So what we're talking about here with an ICRA is a way for employers to follow official compliant guidelines and help pay for individual health plans on a nice, clean, and compliant basis. So the mechanism to do that is called an individual coverage. Again, this is all about individual products. So we've left the group market aside. These are individual health insurance plans that an employer can help pay for through what is called a health reimbursement arrangement. This health reimbursement arrangement, or an HRA, these have been around a long time, but we're basically merging the two things. Individual coverage, so the concept of buying an individual health plan, has been merged with a health reimbursement arrangement, which allows employers to pay for individual health plans on a pre-tax basis. And I know that there's a lot of churches out there where your one or two employees have gone out, they've bought an individual health plan, and the church has just given them a post-tax, an after-tax stipend of money. Again, that's fine. There's nothing wrong with that, but we know that we're just losing out on some of the benefits of pre-tax contributions and payments. Okay, so that's really what an ICRA allows you to do. So let's go through the bullet points. Church employers can give their employees or employee, this can be done with one person, by the way. That's another big distinction with an ICRA, is that you can do this with just one employee. So for those churches out there, you've got one pastor that's your only W-2 employee. An ICRA can be a solution for you. So this allows church employers to give a pre-tax allowance to purchase that individual health insurance. The remaining employee costs can be payroll deducted on a pre-tax basis. Okay, so again, you're kind of getting two things that are hallmarks of the group insurance world to come into an individual arrangement. You're having an employer pay for your premium, and the remaining amount that you might owe, if they don't pay 100% of the cost, the remaining amount that you owe can now be deducted pre-tax through payroll. So those are the two big pieces here that makes ICRA attractive. Again, the third bullet point, we're mimicking the pre-tax savings ability of a group plan. Employees have all the same options of carriers and plan levels that you would see in the individual market. So again, like we talked about, picking on North Carolina, you're going to see Blue Cross Blue Shield North Carolina. You're going to see United Healthcare. Unfortunately, I think in North Carolina, those are the only two carriers left. But you're going to see all of the carriers that operate in your region, and you're going to see all the different plan levels from bronze, silver, gold, platinum. Again, the employer can payroll deduct the remaining amounts due, and they are submitting one bill to the vendor. So, let's say you had 4 employees and they all chose different plans, and maybe one employee chose Blue Cross Blue Shield, one employee chose Aetna, one employee chose Cigna. The employer submits one monthly payment to a vendor, and the vendor turns around and pays all of those carriers on the employee's behalf. So again, it's sort of streamlining the concept of multiple employees going out and buying whatever they want to buy. but we've now funneled everything down into one administrative platform for someone at the church to manage, one bill for someone at the church to pay to the vendor. So again, we're really mimicking what larger employers see in the group market, and we're able to scale this down into a very small 1 or 2 employee population and make the pre-tax savings and the plan administration much simpler for the employer. Again, I think I mentioned this. Yes, I did. You can do this with just one employee. So if you have just one person to enroll with one eligible employee, remember we said you can't do a group plan unless you have 2 eligible. And ICHRA does allow you to set that up with just one eligible employee. And this can also be a great solution. We talked about some of the tax subsidies potentially going away. If the government can't seem to figure that out, and we lose these enhanced subsidies, and suddenly, January 1st, folks are getting those letters, and hey, your subsidy has been discontinued, and we see a big price increase in the individual market. I think an ICHRA can be a great solution for that, as long as the employer is willing to step in and help subsidize the cost, which I think most employers are. If you're already giving a stipend of money, of post-tax dollars, this is a cleaner and simpler way to do it with that pre-tax concept that we talked about. So that is an overview of ICHRA. A few more tidbits here that I'll mention. We work with a vendor by the name of Thatch. I have some marketing materials that I can send to you. We can do a demo of their site. So it's really a turnkey solution, all online, for the employer to administer, and also for the employee to be able to shop for the plans. So that's the other key part here, is that the employee is going to the vendor's website and they're able to see the wide range of plans available to them. So you're kind of doing everything from plan administration and purchasing the plans on one vendor's website. Okay, so I think that's the last thing I want to say about ICHRA. I'm sure that has opened up some questions. So we will, I'll pause here and see what questions we have.
We have a couple questions in the chat. First one from Jennifer is, what is the difference between a HSA and an HRA?
So an HSA stands for Health Savings Account. A health savings account is something that an employer or employee can set up, and it's really where you are taking money and putting it into an account in order to pay for medical expenses on a tax-free basis. In order to participate in a health savings account, you must be actively enrolled in what we call a qualified high deductible health plan. And a qualified high deductible health plan means you don't have any first dollar coverage. That means you don't have copays, you don't have prescription copays, you have this big deductible. It might be $2,000, $3,000, $4,000, $5,000, $6,000, or some of the deductible amounts we're seeing these days. But you've got to meet your deductible first before the plan sort of kicks in and pays for services on your behalf. So there's a couple of different things there. You got to be enrolled in an official qualified high deductible health plan. Then you have to set up the health savings account. And then you have to fund the HSA. And then that simply allows you to pay for medical expenses on a pre-tax basis. An HRA is a method that it can be used for several different things, quite frankly, but as it relates to the individual market, a health reimbursement arrangement allows employers to provide money to an employee. In the case of the ICHRA, they're providing that money to pay for premium expenses, so the cost of the plan. But if we wanted to go down the rabbit hole, an HRA can also be used for an employer to fund medical expenditure prices, or medical costs. So, pharmacy and surgeries. So an HRA can be used for a wide range of things, but as it relates to the ICRA, an HRA is used to fund premium expenses on a pre-tax basis. So they're both mechanisms allow pre-taxable payments. I'll stop there. I could keep going on, but I think that probably answers the question.
That's great. Michael has a few questions here. How do we determine if we have an HRA for tax marketplace purposes? If a church employer pays a percentage of insurance premiums without working through another vendor, is that considered an HRA? And thirdly,
Can I answer that one first?
yes, you can.
Because I think, can you ask that, rephrase, or not rephrase, but ask the question again, the second.
Yes. If a church or employer pays a percentage of insurance premiums without working through another vendor, is that considered an HRA?
No. To have an HRA, you have to have what we would call a plan document actually set up. You've got to work with some type of compliance-related entity, and you have to set up guidelines that the Department of Labor recognizes that you are providing health reimbursement arrangement to your employees. So just doing that, which I know many churches do, does not mean that you have an official HRA. You actually have to go through the process and of course pay a little fee. It's quite nominal, but you have to have those official plan documents that is recognized by the Department of Labor that allows you to officially run an HRA.
Great.
So that would probably answer the first question. You would know if you have an HRA,
Yes.
because of the plan document, it's a bigger process than just
Right.
getting reimbursed. Okay.
Right. We have another question from Ben Winder. If I understand correctly, folks could be made ineligible for marketplace subsidies for themselves and their dependents if we offer coverage deemed affordable, even if we don't cover any costs for dependents, for instance. It seems this could potentially make offering group coverage a net negative for some of our employees. Is that correct?
That's tough. That is a very gray area because, as you may know, employers are not required to offer affordable coverage until you reach 50 eligible employees. And I don't think anyone on the call today is at that level. So employers are not required to offer any healthcare when you're under 50. And then certainly you don't, even if you do offer a group employer plan, there's no requirement of how much you contribute. And so the guideline to test affordability is very difficult under 50 lives. With that said, if you did provide a health insurance plan, and let's say that if you paid 100% of the employee premium, so the employee literally had no cost exposure, that's certainly affordable, right? I think we could all agree with that. Would that negate? So would that negate another employee's opportunity to go out to the marketplace, knowing that their employer provides a plan that is affordable? So I think the question is, would that allow the employee to, one of the first questions when you go to the marketplace is, does my employer offer me affordable coverage? And it's really up to the employee to know the answer to that. They either check yes, my employer offers me affordable coverage, which would turn off the subsequent screens that guides the employee through the process of figuring out their subsidy. Or if you said, no, my employer does not offer me affordable coverage, then the screens would then open up to say, okay, we'll put in your household income and let's do the calculations for you. Because you're under 50, it's a very gray area. I've seen lots of different comments on that answer. So I'm stalling because there's not a straightforward answer. There are documents and forms that employers over 50 must submit to the IRS on an annual basis. My agency helps employers do that, so I'm very familiar with how that works. But when the employer never submits anything to the federal government to say their plan was or was not affordable, how does the federal government track and verify at the employee level what the employer is doing? I mean, they have no idea. So to answer the question as best I can, yeah, technically, if you're offered affordable coverage, you're not really supposed to be eligible for a tax credit. But if you check the box, no, my employer doesn't offer me affordable coverage, there's no backup data or information being sent from your employer to verify the answer to that question. So I think that's where, sort of the Affordable Care Act was rolled out under the Obama administration. And then literally nothing's been done for 15 years. And there's these gray areas that are literally not being addressed and cleaned up, if you will. So that is just a very gray area that has room for interpretation. That's a very long answer. I apologize, but it's a complicated topic.
I think if we, I think what would be helpful maybe is a one-on-one conversation with you and any individual church to kind of contextualize what their situation is, how many employees do they have, how much coverage is the church offering, and then I think you might be able to help guide what would be the best option for their staff, the most financially beneficial. But it may take just a little bit more details on a one-on-one conversation for you to be able to provide which option is best for their situation.
Right. Yep. Agreed.
We have another question from Sarah Gardner. If you are in the process of calling a pastor and working out the compensation package, can you give the candidate to check out the Thatch turnkey service to see premiums and then the opportunity? Thank you, Sarah. Can you give the candidate an opportunity to check out the Thatch turnkey service to see premiums and then check out individual rates to compare whether lower premiums offset a tax break?
Yes, you can do that. And for those of you that want to see that and what it looks like, I'll just do that real quickly for you. Reshare here. So this is a public website. This is the Thatch's website. I'm still figuring out how to say that. It's interesting name of a company, but we've done some business with them, and they have done a very nice job with this somewhat complicated approach to healthcare. But again, this is a public site to answer Sarah's question. So what you can do is put in your information. I'm going to do something crazy and give out my age. And get results. Of course, you can see that you can add dependents. So when I click get results, this is what the site kind of looks like. And I'm skipping through a little bit of the, oh, sorry. Well, let me just start over. I think I clicked the wrong button. Apologies.
Oh, and while you're doing that, this is Rob Fox. It may be good to mention that there is a fee per employee and there's a fee per employer for the service, correct?
Yes, there are fees that you have to pay to Thatch. Certainly, it's all sort of baked into the program. So just as if you wanted to install a group health plan, yeah, it's there's price involved. It's all sort of baked into the package. But yes, what you would see on this site is not going to be. No, I take that back. What the employee would see on the site would be the exact same price as going to the carrier's website. But behind the scenes, the administrator would have some additional fees that they would have to pay. And obviously, those are all public and disclosed, and that's part of the conversation to set up the plan. So it's not that it's a mystery, but yes, that is correct. Oh, and here's the button I meant to, was sort of hiding for me. Okay, so Sarah, back to your question. This is what we could send to that pastor that's being called. This is, again, the public site. The only problem is that this is the full price of the plans. And so as part of the Thatch ecosystem, we would work with you to build out that employer contribution. Is the church going to pay half of the employee rate? Is the church going to pay 100% of the employee rate? What you're seeing here on the screen is just the full cost. But you can see based on my zip code, my age, because we talked about the price is different based on everyone's age. So these are all the plans that are available to me, and the price that it would cost. So as any shopping website, you can filter things. So let's say that I only want to see gold level plans. I can filter that out. Let's say that I only want to see Cigna plans. So now I've filtered that further. And so again, you can see the full range of all the plans that are offered by the carriers in your geographic area. So I believe that answers your question, Sarah. And I think we emailed the other day, so if you want to connect with me, I can get you this link.
We have another question from Richard. Do you know admin fees Thatch charges at a TPA for an ICRA?
I believe in the small group market, I believe it is an annual fee. I want to say it was $150. And then they put on an additional per contract charge. So each person that enrolls, they put on an additional amount. I want to say it can range anything from 20 to 35-ish dollars. So there's sort of one overarching administrative fee, and then there's a per contract fee. And if you want to see the exact numbers, I would offer, we can get more granular if you want to see a proposal, and then you would see all the fees on the quote. But just from memory, that's the range. Sorry to cut you off, Nicole.
No. In your experience, are these fees offset by savings since employers are paying premiums on a pre-tax basis as opposed to providing an after-tax stipend?
I'm gonna plead that's more of a tax accountant question.
Okay.
Yeah, I just I think it's so complicated and beyond my scope to analyze pre-tax savings, post-tax savings. I know that the concept is there, but I just think it's so different for everyone's specific situation. So I can't answer that.
Okay, great. Another question from Stephen. Can you offer your guidance on how much a church might consider spending on health insurance for employees as a percentage of payroll?
As a percentage of that individual person's payroll?
I believe so. I believe that is what he's asking.
Well, I might fall back to the federal guideline, could be, or total. I'm going to fall back to the federal guideline. And when we talk about affordable coverage, which I think, in the 50 plus market, which there's, hundreds of thousands of employers in the 50 plus market, and they're required to offer a health plan that is deemed affordable by the ACA guidelines. And I can tell you that when you think of an hourly rate of pay, any employee that's earning around $15 an hour can be expected to pay around $170 per month for individual coverage. So I'm kind of answering the question by backing into it and saying, whatever the full cost of the coverage is, $800 a month, then if the employee is not expected to pay, in order for that plan to be affordable, if the employee is not expected to pay more than $170 a month, and again, these are sort of the calculations being done at employers across the country to have affordable coverage, then maybe we kind of back into the math that way. Instead of saying, let's take someone's payroll and using a percentage of payroll, because it really is kind of the same thing, I guess, is what I'm saying. So I'm not sure if that helps answer the question.
I think we see churches a lot of times cover and Rob, you can help me with kind of what we see as a range for churches, but typically churches try to cover at least the employees' premium of health insurance. Some employers or churches then offer a percentage, or maybe they even offer the whole family's coverage. Rob, would you want to add anything else to that?
No, I think that's correct. Normally they're covering 100% of that primary employee, but maybe not the family, or maybe a small percentage. But I think Stephen's question's like, how much should a church be spending overall payroll on health insurance? And that's a really tough one to answer. It's like many of these things, it's so contextualized per each church. So that's where the conversation with Owen can help.
Yeah. Yeah. Such great questions. We are coming up on time, so I'm going to just point to our chat. Beth Jones is going to be dropping in a survey for our webinar into the chat. Please take just a few minutes just to let us know how helpful you thought this webinar was. You'll also be receiving an email once we conclude the webinar with a recording of the information that you can watch again, because I know you are so anxious to watch it again, or pass it along to people at your church or employer who you think it would be helpful. Owen, thank you so very much for joining us today. We are always so grateful for your expertise. And there's also in the survey an opportunity for you to request a phone call or email from Owen if you have more questions, or if you want to talk to him in more detail and contextualize what the needs are for your church. So Owen, thank you so much.
Thank you so much.
All right, everyone, have a wonderful rest of your day, and we will see you on the next webinar. Have a great rest of your week.
Bye.
Bye-bye.